Thank you for watching this presentation, which is called Continuing Care Overview. Keeping all of your patients on a consistent recall cycle is extremely important, yet extremely difficult. If your patients come in every recall cycle, they will be saving themselves pain, time, and money. Any issues they are having with their teeth will be diagnosed quicker, which will result in avoiding pain, getting the work done quickly, and saving them money in the long run. So, when your patients leave without their next recall appointment scheduled, you need to have a system to avoid letting those patients fall through the cracks. There are 3 phases to this system, which we will look at next. The first phase is utilizing Smile Reminders. Not only does Smile Reminders confirm appointments for you, it also sends messages to patients who are overdue for their recall appointment. When a patient is 1 month away from their due date, they will receive a reminder text or email. They will receive another message on the day they become overdue. After those initial 2 messages, the patient will receive a message every 3 months for 2 years. The great thing about these messages is that they are completely automated. They also allow for the patient to request an appointment, which automatically sends you an email. But simply relying on Smile Reminders to reactivate patients isn't enough. Let's take a look at the second phase. The second phase is to utilize the Continuing Care List in Dentrix. By generating this list, you will know exactly which patients need to be called each month. The patients who need to be called were due 2 months prior. This will catch them in between messages from Smile Reminders. To generate the Continuing Care List, please watch the step-by-step video following this webinar. Once you have generated this list, every patient on that list who does not have a scheduled appointment needs to be called before the end of the month. Every call needs to be logged in the office journal to ensure that we are not over or under contacting any of our patients. The final phase is to mail patients who are severely overdue a direct mailer. Some people won't respond to texts, emails, or phone calls. So to try and reach them one final time, we will send a direct mailer for patients who are over 2 years overdue. The mailer they will receive will have an offer for a free fluoride treatment at their next visit. The hope is that the free fluoride offer will give them some incentive to schedule their appointment. If your clinic maintains a reappointment rate of over 85%, the steps in the continuing care system will be much easier to manage. Always focus on maintaining a high reappointment rate, as it is the #1 way to keep a healthy recall percentage for your patients. To get patients back on their recall cycle, you cannot simply rely on one method. If you follow this system, each overdue patient will be contacted in some way 11 times over the course of 2.5 years. As I mentioned earlier, please watch the step-by-step video for generating your continuing care list in Dentrix each month. Thank you.